Welcome to ESC TV. My name is Martin Manninger from Graz, Austria. I'm currently the chair of the EHRA Young EP Committee, and with me are the two national ambassadors of France and Slovenia, Corentin Chaumont and Tine Prolic-Kalincek. Thanks for being here. So what is a young ambassador? Young ambassadors are the national representatives of their Young EP committee in their country. And these two were recently awarded with prizes for the biggest increase in membership numbers. So this is why both of them join me here to answer questions about EHRA membership and the Young EP committee. Thanks for taking the time. Let's start with Tine. So you had an impressive increase in membership. How did you manage to do that?
Yes, thank you for this amazing opportunity to invite me here. I think the major step to increase our numbers was actually bulk membership, EHRA membership. So the National Working Group bought bulk membership from EHRA and offered it for our community, Young EP community. And with this step, we were able to increase the numbers by quite a lot.
So a bulk membership is a membership that is taken over by a whole country, and then these membership fees are taken over by the society. And is this connected to any to anything that young EPs have to do, or is it like for specifically awarded to young EPs in any way?
In our country, it was available to anyone who wanted to join. It was free of charge. The membership fees were taken over by the working group, the National Cardiology Society, and everyone who wanted to join, they were able to join.
It's a really excellent initiative, and I think a really successful thing for EHRA and the recognition for the work you're doing on an everyday basis. So, Corentin, what are the benefits of being a EHRA Young EP member?
I think there are many benefits related to education and training first. I really try to put education and training as the top priorities when I started as a young ambassador for France. And also great opportunities in terms of networking. I think it's a good opportunity to meet many young EPs from different European countries and to build new research or education projects for tomorrow. So that's how I see the benefits in terms of this young EP community.
And I also heard that you did an excellent job in organizing certification exams in French for the local community, and this might have also helped. Right?
Yeah, that's a good example in terms of training. As you probably know, the young French-speaking EPs were not participating so much in this EHRA certification process so far, probably because they had their own training and certification national pathway. And we truly think that medicine and EP should evolve through a more harmonization across European countries. So we really try to communicate a lot. And last year we reached a nice milestone because the first French version for the CIED exam was proposed to young French EPs. And the results were pretty encouraging because more than 50 young French EPs participated with good success rate, actually around 70%. And we will try to build on this momentum this year because we will propose the first French version for the EP exam. And we will try to pursue in this way for the next years to ensure that a great number of young French EP can take part into this European certification process. I think it's truly important.
It's a really excellent initiative and really hard work that you've done there to implement this. So we had several surveys addressing all these certification aspects and the differences in between the countries. So what is the French version of that? So is the EHRA exam included in your local certification anyway, or is it like a parallel system that is going on?
So right now it's still a parallel system. It's not mandatory, but we are strongly encouraging all young EPs to take part in it. And I also have to thank actually the French working group on cardiac pacing and arrhythmia from the French Cardiac Society, because they really helped us into funding and they actually they, for this first version, they pay the inscriptions for all the young EP from the young French community. So that was very helpful also in increasing the numbers for these first years with this French version. So we will try to keep on.
This is a really excellent step, and it's also encouraging to see how many, even in the parallel system, how many are still signing up and doing this. And this means like how important the EHRA certification is, right?
Yeah.
Yeah. So really great job. And so Tine, what can EHRA do for the young community? So why would it be important to become an EHRA young EP member?
So EHRA offers a young EP member actually an amazing opportunity to expand their knowledge. It's an amazing educational hub. It offers amazing opportunity to also network during the congresses or maybe joint sessions. And with that, you can progress regarding your knowledge and also your network broadening. So what EHRA can do for young EP is actually to launch your career even further than what you will be able to do solely in your local community or national community.
And this is then exactly what you can do for EHRA, right? So it's a win-win situation. What we're really trying hard in the EHRA Young EP Committee and community is to involve young people in the Congress and also in parts of the Congress with different aspects that we had at the Congress, like the tracing sessions, the ECG competition, the entrainment workshops, and so on. So I think this is a really nice example of how the young community is like integrated in the whole system. So I think this is well acknowledged, but it also means that we have to deliver and really be an active part of the societies. Yes. So thank you both for taking the time.
Thank you very much, Martin.
So we wish you all a nice Congress, and thanks for being here.